Dr. Paul here. We have a case of hyperbilirubinemia, which causes jaundice in newborns. This is a young child who had a bilirubin that hit 22 on day 9. And this is our follow-up, day 12. Let's go take a look.
Hello!
And this is called the Butani nomogram. And this is bilirubin levels of 5, 10, 15, 20. And this is your hours of age. So when he was in the hospital, it started off at 24 hours at 6.7, which is just barely in the high intermediate risk. It went right to about between low and high intermediate at 10, a bilirubin. And then you went home and everything was going fine.
Yep.
And this actually, my chart doesn't go up far enough, but day 9, we were at 22.
Yep.
And that's definitely in the high risk zone. Not good. When you have bilirubin in the high 20s for about 3 weeks, it can cause problems with brain. You probably know that's why we worry.
Yeah, exactly.
So obviously, we don't want to take chances with brain. Okay, buddy. There's those eyes. There we go. Sometimes the up and down will get the eyes to open. They're just a tiny hint of yellow.
Yeah.
I'm fairly reassured that this bilirubin's going to come back about the same as it was in the hospital, the 14.
Okay.
And that would be fine.
Okay.
I want it to be lower. If it's way higher, we're going to get aggressive again with phototherapy because, again, it's that high over time that we don't want. Hi, it's okay. Now, looking at the skin, folks, this is just a hint of yellow in a normal, little babies are pink. Oh, baby, it's okay. I know, it's okay. Yeah, I know. So we have a hint of yellow here on the face and chest, but really not that bad. We'll warm the heel, check his bilirubin, and take it from there. And if it's gone back up, we're going to start the phototherapy again and really push harder on the feeds. We have got to flush this bilirubin out to protect the brain. If the bilirubin's slightly higher, we can do phototherapy at home. It's called a wallaby blanket, and that's a lot easier than going back to the hospital. So we sent the blood to the hospital for the bilirubin and the results are back. I'm going to call the parents. Hi, it's Dr. Thomas. Yeah, we got the bilirubin result back and it was 17.8. I was sort of hoping it would be a little bit lower, so we definitely need to get the phototherapy going again. We're going to have a company come out to the house, set you all up so you can do phototherapy at home and then feed. I would highly recommend go ahead and supplement, even though I think you probably have enough breast milk to just sort of do okay. We've got to flush this bilirubin out so that we avoid the dangers of long-term high bilirubin. Yeah, I know. I wish it was better news, but hey, it's gonna work. You got it down before, you can get it down again, and we'll check you again in a couple days. All right.